Hi, this is Dr. Ken Rictor with Curbside Consult. Thanks for joining me today. Today we're going to talk about opinions versus facts in medicine. Let me give you a very real scenario. A patient comes in with back pain. They get an MRI. One specialist says, you need surgery. Another says, you need therapy. And the third says, you just need some time. Same patient, same MRI, three completely different plans. So what changed? Well, not the facts, the opinions. And if you don't understand that distinction, you can be pulled in directions that may not serve you well. Now, medicine operates in two layers. Layer one are the facts. These are objective, lab values, imaging findings, vital signs. They're measurable, they're reproducible, and they are consistent. But layer two is interpretation. So what do we do with these facts? That's where medicine becomes less precise and much more human. Let's take that MRI. It shows a disc bulge, degeneration, maybe some narrowing. Those are the facts. But here's what most patients are never told. A large percentage of people with no pain at all have those exact same findings. So now the real question becomes, is the MRI the problem or just a description? That's where opinion enters. Let's take blood pressure. You walk into your doctor's with a blood pressure 150/90. That's the fact. Now what? Medication today? Lifestyle first? Recheck in 3 months? All are reasonable. All are defensible. But they're not all the same. Now let's go one level deeper. Let's say you get a scan. It shows something abnormal. Now most of the time, that finding is incidental. But once it's seen, it's really hard to ignore. So what happens? More imaging, more tests, more procedures. This is what's called the cascade. And sometimes the cascade creates more risk than the original issue. Now we need to be honest about something. Healthcare systems reward activity. Procedures pay, imaging pays, intervention pays. Thinking, waiting, and explaining often does not pay. So even when no one intends harm, the system leans toward doing more, and over time, that shapes behavior. Here's the mindset shift. Do not assume that recommendation equals necessity. Instead, ask, what are my options? What happens if I wait? What is the actual risk? Is this urgent or just available? And here's the single most powerful question you can ask. What would you recommend if this were your family? That question changes the room because it moves the answer from protocol to principle. Time is one of the most underused treatments in medicine. Pain evolves, inflammation settles, conditions declare themselves. But when everything is treated as urgent, patients are rushed into decisions, and rushed decisions are rarely the best ones. So here is the framework to carry forward. Facts are stable. Opinions vary. Facts should guide, but opinions should be explained. And good medicine happens when decisions are made with clarity, not pressure. If you understand this, you will navigate healthcare differently. You will slow down when needed. You will ask better questions, and you will make decisions based on understanding, not fear. And that is where good medicine lives. Thanks for listening, and I'll see you next time at the Curb. It's Dr. Ken Rictor with your Curbside Consult.